We're really happy to announce that we have Dr. Bryn Heineman here. She's joining us in studio, and first of all, we're really excited to have you.
Oh, thank you.
And
thank you for having me.
To ask you the questions that people are wanting to know from a medical standpoint.
Yes.
And I guess we'll start it off with, how did all of this evolve, and how did you get into prescribing medical cannabis?
Yeah, was that something you knew right away? You thought you'd prescribe?
It was patients.
Oh, really? Yeah.
It was my patients, and almost any patients I saw at different clinics when I was a locum. People would come in and say, how do I access cannabis legally? I've tried it, it's helped for pain, or my friend's using it. Will you prescribe cannabis for me?
Now, we should mention you're a naturopath, you're a medical doctor as well, so an ND and an MD.
Yes.
So you understand plant-based kind of medicine,
yes.
You understand Western medicine. Not everyone in your line of work is as open to the idea.
Yes.
As say you are.
Yes, I've always been open to plant-based medicine, and I use it and I see the effects. But what I didn't know, and I'd say what most physicians don't know, is how do we authorize cannabis? How is it done? What's the paperwork? What's the legal way? Because there's not training in that.
Well, that's a great question. So how does that work? So I'm one of your patients, and I've got, whether it's, and I don't know what condition you have to have, but
arthritis,
I've got chronic
knee pain,
of some kind.
insomnia.
Exactly. How would it work?
How it would work is I would do a history to understand the nature of your pain. And if you're my patient, then I would know about you, when the condition started, how it bothers you, what you've tried. And I do a screen to see if people have had addiction issues in the past, even though the likelihood of addiction is very low with cannabis. And I go over options and say, is this something you're open to? Or often they ask me. And I describe different forms of the medicine, and we start really low and we go slow. And I go over side effects they could have, which is usually a racing heart or feeling a little bit anxious, or else groggy, like the stone feeling that they don't want to get. And then they try it, and then they come. We've got to follow up and see how things go.
Do some of your patients, do they come in kind of with an open mind, or when you've kind of put that forward to them, the cannabis side, is that something that people
so stigmatized? People often say, oh my gosh, I smoked a joint when I was 18. Patients in their 50s or 60s, like, I don't want to get high.
Right.
Which is common. And the theme we say is it's not getting high, it's getting help. Yeah. And educating that we don't have to have what we call the psychoactive effect, like feeling groggy or stoned or lethargic.
So it's not the same joint that they're getting for medical purposes, for pain management, as they would the guy who's going out on Saturday night. Is it a different joint? Does it just affect them different?
Well, that's a very good question. So cannabis from a licensed producer, from a physician, is tested, meaning it's the same plant and herb, could be a different strain. The one you get on Saturday night would not be tested. We wouldn't know exactly what's in it or what strain. Yeah. Whereas if it's from a licensed producer, it's tested and we know what's in it.
Is the THC level different?
So yes, you can choose different strengths of the THC. THC is the psychoactive, and CBD is more anti-inflammatory.
So that's what we were asking.
I was wondering.
Can
you kind of explain?
Because you see CBD pills and so what's the
So one gets you high, one doesn't?
Well, so with all plant-based medicine, it's the interaction. It's called the entourage effect. So many different compounds working together produce the greatest healing effect. Versus in synthetic pharmaceuticals, we isolate different chemicals to make a drug. Okay. So you never just get one thing in a plant-based medicine, but we would have a majority, an amount, a ratio of THC to CBD. And so traditionally, THC is what we test in urine, and it's what could give us a high, the psychoactive feeling. Whereas CBD is a really potent anti-inflammatory. So you think of an Advil or a Tylenol, that's an anti-inflammatory.
Right.
And so that's what the CBD is. But there's always a bit of THC, and we need some of the THC to make the CBD potent.
So there's pills, there's creams and ointments.
How many different things?
Yes.
You don't have to smoke it, really, for patients.
That's a very good question.
It's
becoming more and more common to do non-inhaled methods. So vaporization is the more safe form than smoking, because you don't have as many toxic byproducts of actually smoking something. It heats it to a high temperature, and there's no odor. So if people want to discreetly use or not fill a room, they will vaporize. But yes, we now there's oils, and there's capsules and topical solves. An oral product that in oil or capsule has a longer duration of action in the body, whereas anything taken through the lungs goes into the blood quite quickly. It's like a rapid onset.
Can I go back to the
Yes.
CBD thing? I just wanted to ask a question about that. Can people function when they are taking a CBD pill to relieve pain or whatever?
Absolutely. Yeah, to be alert, to have cognition, to be able to think at their job, to respond quickly, yes.
So they can live a normal day-to-day life taking a CBD pill. They can drive a car. Is that all?
Yes, yeah.
Okay.
And some people can tolerate small amounts of THC as well. It depends on the tolerance. Like if someone is drug naive or cannabis naive,
Yeah.
they are probably more sensitive. But it also depends, I think, a bit on what we call the pharmacogenetic effects. Like we all metabolize drugs differently.
So if someone gets a prescription, just for those that out there that think,
Yeah.
okay, I went to see the doctor, I have the chronic pain, I got my prescription. That doesn't mean you just go down to the dispensary at the end of your street.
No, this is another good question,
Okay.
which we all have to learn about because it's very confusing for
Yes.
doctors and patients.
The difference, yeah.
So technically, storefront cannabis is not legal. So to walk anywhere and buy your cannabis is technically not legal. Decriminalization is happening, obviously, because we've got loads of dispensaries. And dispensaries will have products that Health Canada hasn't approved that patients cannot get from a licensed producer, like a topical solve for joint pain.
So, so that's interesting. So the place you prescribe, again, cannabis for my pain relief, if I go to the licensed grower, licensed supplier, only
Your options are
smokables?
few.
Well, they now have capsules and,
Okay.
and oils.
Oh, okay.
It took a while, but Health
Okay.
Canada's approved them, and we do. Yeah,
Because that would be key, because I imagine, as you said, some of your patients go, I smoked a joint when I was 18, I don't want that. They
Yeah.
would probably feel a lot better about taking a pill or putting on a cream. I would think.
Exactly, and doing it legally. A lot of people will present themselves saying, I self-medicate, I really want to do this properly or legally.
Right.
And the licensed producers, their cannabis is tested rigorously, so we know exactly how much THC, how much CBD, and mold content and residues, all those kinds of things. So it's a standardized product from a licensed producer versus a dispensary. That's what we call the black market. We don't always know where it comes from, and consistency can be hard. A person might get a product and then say, well, the product's not there in 3 months' time.
Right.
So strain-wise, are there different strains that are helping with different ailments? Are there...
Apparently, there's not much evidence for strains being that specific. Like there's indica and sativa, generally
Right.
the two main ones, and one is more sedating or calming, and versus one is a daytime one. But from what I read in the literature, in the medical literature, and from physicians who are very learned and they just do cannabis, there doesn't seem to be a lot of weight in studying the strains, so much as the different THC, CBD, and there's CBN. There's more and more cannabinoids that we're just discovering how they're working.
Are you surprised from when you started practicing to where we are now? How things have changed and how, there probably wasn't any dispensaries open when you started practicing.
Yes.
Or not as many as there are now.
Good question. Yeah, absolutely. Dispensaries are growing. I think questions about it
The
are
attitude
growing.
too. The stigma seems to be
The attitude.
changing a little bit too.
Yeah, and the climates are very different. In Ontario, and my friends and colleagues in Ontario, I mean, as you know, probably the provincial police were, shutting down
Cracking down,
dispensaries. And whereas here I know officers who were, friendly with the dispensaries in Hastings Street and more questionable parts of the city where it's very amicable. And the city of Vancouver is certainly happy to collect business taxes from all these dispensaries.
Yeah, why
it's
not?
It's very confusing because nobody's going out of business here.
No, that's
In
why we're
BC,
here,
yeah.
because it is confusing. We're trying to cut through it all because
Yes.
you think it's illegal, but yet there's 32 stores on that one block right there.
Yes.
It's hard to get your head around.
Yeah, and they're in business.
A question about the medical side as
Yeah.
well. So people can go into a dispensary and get a card
That's right.
from a
card.
doctor. Is that a doctor or
Is that the same as seeing
the
you?
same as
So
seeing? Yeah.
that's a good question. No, I've heard, I know from my colleagues, naturopathic doctors and doctors of traditional Chinese medicine have been strongly warned that they're not allowed to authorize. And that's because, so it's a federal document when you give an authorization. It's a federal document and only medical physicians can authorize it. So if they do get a card from a doctor, that dispensary might have a Skype video consult service with a physician who does that. But that's not usually the case, I don't think.
Well, no, it depends.
The card,
It depends. You've heard of a variety of stories. Some have a doctor on staff that just is there. So you go in and go, my knee hurts. Oh, well, if your knee hurts,
right.
let's take
And then
care
they
of it.
do
Got
a
my
quick
toe. I think I
Right,
need to
screen.
smoke a joint.
There's very few what we call contraindications in medicine,
Right.
like reasons that we would say, no, you're not a good candidate. This would not be good for you.
Right.
There's really not many. It's a very safe medicine, and there's not many contraindications.
Where do you think we're moving to? It's hard to look into a crystal ball and see, but it's changing so fast. And it seems like it's an ever-changing kind of process as they kind of work their way through it. Where do you think we are in a couple of years? Are more and more doctors prescribing? Does it become a little more commonplace?
I mean, I think when the streams are really differentiated, when there is a legal recreational stream, I think the medical side will be even more regulated and accessible, because people will clearly want to know where to go when they're not going to a certified store that's legal to buy cannabis at,
right.
when they want professional help. I mean, there's not too many clinics, but you can Google and find clinics and physicians who authorize. So I think there will be a higher demand for physicians who do authorize cannabis, because there's still not many.
Well, no, and I'm thinking now there's probably the people are doctor shopping for that reason alone.
Yeah.
I want to do it. I want to do it legally, because it's, look,
Yes.
you can bypass the whole medical part easily enough anywhere in the lower
Yes,
mainland.
that's right.
Having,
You can
just self-medicate.
Yeah.
But as you mentioned, some people, no, I want to make sure I'm dotting the I's, I'm crossing the T's, I'm following those. And I would imagine they would have to doctor shop almost to find, if they
if they
Yes.
want that.
if my doctor for the last 15 years won't prescribe it for me because he or she doesn't believe in it, okay, well, now I have to find a doctor that does, and it almost becomes...
Yes. Yeah. And there's not a lot of time. Like, the amount, it's because it's a passion for me. I've chosen and I want to learn more about it. But there's no training or continuing medical education. Like, it has to be out of passion or will, I think, for a physician to want to learn about it.
Does it take a patient, we're going to get some questions from our viewers, but
Sure.
Does it take a specific patient, and not a specific as you identify one, but someone who comes to you that, you know what, the other stuff doesn't work, they don't like it, and even if I've never prescribed it before as a doctor, I'm going to try this out with this patient. Does it take a patient to force a doctor to kind of outside their comfort zone, maybe?
Yeah, I think especially a patient they know and
Right.
trust. Yes, that's often how we learn best, is we learn, patients teach us, or we learn or we hear stories and see there's something here.
Right. Fascinating.
Absolutely.
So we do have a whole bunch of questions
Great.
for you. This is going to be the first one, and it's actually something that I'm very curious as well, because there was some talk in the papers last year. So Andrea asks you, the comment on use during pregnancy. Is this is, I know this has been kind of a topic
That's a very good question.
Wow.
So, I mean, like a lot of medicine, drugs, lifestyle, and pregnancy, it's not something we study very much at all, because really, who wants to be in the study group,
Right.
or the non-control
Yeah.
group?
Right.
Well,
yeah.
let's just see.
No, no, yeah.
Just go to my new baby.
Right. No, you know what? That's a super
So,
interesting point.
And I know some women who would have very small amounts inhaled for acute nausea in pregnancy, and they did that on their own choice and felt fine, and they've had healthy babies. But I mean, I can't comment on any evidence, but it's something that it's hard for us to ever find evidence on.
That's
and the
fascinating.
worry is with the developing brain, THC, and a psychosis link. Bottom
Okay.
line in anyone. That's why our colleges generally see 25 and under.
Right.
Or else 18 years and under. That's where the worry is with the THC in cannabis, whereas other parts of cannabis are used for childhood epilepsy
Right.
and
Yeah, oh,
cancer.
yes.
Yeah, totally.
Seen a
Very,
lot of cases like
and
that, yeah.
glioblast brain tumors, very successful, and that's more the CBD, but there is
Right.
also the THC. So I kind of jumped ahead, but I can't speak. I mean, I wouldn't recommend it in pregnancy, but that's because I don't have the knowledge.
Okay, because yes, people are talking about it's helping with nausea and it's helping with all these symptoms, but I guess if there's
I have
not
heard
too
for
much
nausea.
backing it. Mm-hmm. Okay.
That's interesting. Yes.
So I have a question from Matt here. What about the effects of smoking marijuana? Is it harmful? Because a lot of
that's a
people
great
say
question.
one joint's a pack of cigarettes.
I have some colleagues who focus just on cannabis and have there's a bunch of research and evidence now that it's counterintuitive, but inhaling can be helpful for chronic lung disease and asthma. For what we call chronic obstructive pulmonary disease and asthma, it can actually increase like the lungs can open up more, and it can be healing.
And
It can
smoke,
improve
though?
outcomes in spirometry.
Because they talk
In
about
vaporized, and this is even in inhaled smoked forms. So I don't have the study to quote it. I know my
Right.
colleague who does, but it's incredible if people do research the evidence that is coming out.
I would think that smoking a cigarette with all the chemicals and tar that's in that would still be worse than smoking a joint.
Absolutely.
I would think, like just from the amount of stuff that's in it.
Yep.
That alone should
Absolutely.
tell
but the
you.
carcinogens.
Yeah.
That's what
Right.
I'm wondering is just the.
I
'cause
think
you're
it's
actually
over
smoking,
4,000
right?
chemicals in a cigarette.
Yeah.
Wow.
That's
Crazy.
the rough count. So we can't compare them.
Wow.
Dr. Hyman, thank you so much
Thank
for coming
you
in
for
today and
having
spending
me.
some time with us.
Really
We
enjoyed
appreciate
being
it.
here.
I have a hunch that we will call on you in the future. Should
Yes.
a medical
Great.
question arise, you can be
Great.
our
We'd love to
medical
try and help.
expert.